So good morning, one and all. Once again to the reading club. Thank you so much, first of all, for giving me this space for reading our legend, Dr.Prafful Vijaykar sir, our guru, our respected guru sir's books. And now we are reading the third book, that is the end of My Assumptions of Miasm, where we have already dealt with the soric miasms, the sora, and then the various diseases of that. And now the psychosis is also over in our last class. And today, interestingly, we are going into the next lesson. That is chapter 12 about the syphilis. Let us deal with the various physical diseases of syphilis, which will be of very useful for you in your day-to-day practice in your clinic. Pathogenesis of syphilis or destructive disease. Page number is 101. Are you all ready? Yes. So, when a cell cannot cope up with the invading organism, pathogen, or toxin by using the physiological defense, that is the SORA, if SORA fails, it goes to the constructive defense, that is the psychosis. If psychosis also fails, it decides in despair to adopt a do or die attitude. Of the 100 trillion cells, every cell, as the textbooks of pathology teaches, lives and works to maintain biological equilibrium. So what is this biological equilibrium? That is nothing but the homeostasis. That is what we say is our vital force is happy enough, no? And it is the, what is that? Autonomy, no? Yeah. Autocracy, yes. Okay. Biological equilibrium inside the human being. If the equilibrium is maintained, that is, the homeostasis is maintained, the whole being remains healthy. This means every cell has concern for the whole being. Every cell has concern for the whole being. So this is why when the whole being is affected, we can always look into the pathological changes. What do? We will go for being is affected, but what are the changes at the cellular level? We are interested in that. And what do we look for in the case of a when we do the investigations like MRI scan or a CT scan or a USG, we will look into the changes in the at the cellular level because the cell decides the whole. So when the whole being is affected, we are interested in the changes in the cell, in every cell. So it is generally a selfless service of a part to the whole. When the whole being is under attack, it may decide to sacrifice itself to save the whole. This is syphilis, and this is what we are talking about today. Thus, a cell or tissue or a part of the human being may be distorted, disfigured, or even degenerated if to save the whole human being. You are all thorough with all these things. Distortion, disfigurement, degeneration. The degeneration or destruction is by two means. One is necrosis and the other one is apoptosis or apolysis. So we are going into the details of necrosis and apolysis. Very important in our day-to-day practice. So what is this necrosis? This is a process by which the body discards the deceased part that can be dangerous to the body in future. What is this? If there is a circulation problem or if there is an ischemia, if there is a lack of blood supply, initially there will be inflammation. That is followed by some changes in the cells, like constructive changes in the cell. If that also doesn't work, what will the body do? It will just cut off that part, and that is known as necrosis. Necrosis of a digit of any finger or a nail or a toe. Yeah. Have you all heard of thromboangiitis obliterans or gangrene of the finger? So, what are the different kinds of necrosis? So this is brought about either by karyolysis. Karyolysis means what? That is the destruction of the nucleus of a cell, or coagulative necrosis. So in coagulative necrosis, the cell structure will be preserved, but then the nutrition will be cut off. The cell will be dead. There is ischemia, there is no oxygen, there is no blood supply. So the cells are dead, but then the cell structure will be preserved. Even the digit will be preserved. You would all have seen such kinds of digits like blackened digits. The digits are not cut off from the body, but the blood circulation is cut off and the finger or the toe will remain like that, like a black stiff thing. And it will be like there will be no function for that, but then the structure remains there. because the blood supply is lost. This happens in myocardial infarction as well. In certain areas of the heart, the lower wall, the inferior wall is under ischemia. That remains there, but then that part will not work. It is dead. The cells are dead. Only that part is dead, but it remains. Or in kidney infarction, or remain, but then there is no function for that, and the area will be dry and pale. Whereas in liquefactive necrosis, the next one, liquefactive necrosis, what happens is there will be a lot of discharge. Yes, that portion will become liquefied, or there will be dissolution of the cell as such, and there will be a lot of slough there. And the tissue or the cell will be converted into it will be sloughed into a liquid mass. The dead cells are broken down by enzymes, and there will be a lot of pus. And this happens in infections and in abscesses, in septic conditions. In abscess, this liquefactive necrosis happens. And another kind of necrosis is fat necrosis. So what is this fat necrosis? Again, fat necrosis can be traumatic. Traumatic means what? After an injury. Yes, after an injury. Generally, this happens in fat-rich area. One of the fat-rich area in our body is either the upper arm or it can be the breast, the mammary. So, okay, I shall go into little more detail after completing this. So, okay, first of all, let us think about the digits. When we talked about the digits, we thought that we will talk about the functions of the digits as well. So if it is the thumb, if it is the index finger, what does it mean if it is the middle finger? What does it mean if it is the little finger, etc., and the toes? What do you mean by thumb? If it is the thumb, if it is the right thumb or the left thumb? Yeah. Yes.
Right, head of the family.
Exactly. It is a superior. It is a head of the family. Or it can be something related with our ego. Yeah, where we had to shed our ego, where we are insulted. There, the thumb can be affected. It can be the head of the family, head of the institution, or even it can be a question of luck also. No, like sometimes when we say a thumbs up, okay, best of luck for you. So where the luck is gone, where you have fallen down and your ego is hurt, there you can get some problem with the thumb. And if it is the index finger means what? Pointing out, pointing out the mistake. Index finger. It is for knowledge. It is for education. It is for an argument. Yes, generally, like when people are say during their speech and all, sometimes like when they are asserting a point, they will be doing like this. No, it is not for fighting always, but it can be for fighting also. It can be an argument when the finger is pointed against you. Hey, come on, you. This is not right. This is not right. That kind of a movement comes, no, with the index finger. So it can be for knowledge, for education, for pointing out a mistake. That is when you are critical about something, when you are censorious about something, and it can also be about ego. Hey, don't come near me. It can be about the ego also. And coming to the middle finger is something about our work and research. Sometimes it can be about sexuality and anger also. Middle finger. Yes. Yes. Middle finger is for work, for research, for anger also, suppressed anger or any kind of anger, and something related with the sexuality also. Then the ring finger. Ring finger, you all know what is this ring for. You all heard about the wedding ring, right? So ring finger is always associated with your spouse, with your partner, with your relationship. Yes, Shubhangi, it is about the partner. And coming to the little finger is somebody of lesser important, least important. Yes, Sai Narendra, least important person. Yes, least important person in the life. Sometimes it can be sometimes a pet also. Your pet or sometimes no, like sorry to say this, but then servant maid or servant maid's daughter, somebody like that can affect, or anything from the social strata also. When you have any negative impact from the society, that can also affect your the little finger. All these things you can balance according to the right side and left side. The same conditions, the same conflicts, but then the right side and left side you have to balance. What does that mean? If it is the right side, everything comes from the father's side or from the spouse side or from the workplace. Whereas if it is on the left side, it will be from your home front. Okay. Now coming to the, if any scratching or any itching happens between the fingers, what is that? Between the fingers means what? That is again some irritation, no? Like something trivial thing, some trivial thing which happens in the day-to-day life. It's an everyday affair, something for which you are irritated for. Day-to-day, irritating. Yes, day-to-day irritating. And in general, you all know fingers means what? Fingers means money. Fingers means money and palm means education. Palm means education, or sometimes palm can be asking for. When you're asking for something or when you're begging for something, what will you do? Yes, that is also for the palms. Sai Narendra is giving an input, aversion to work. That is also now like when some irritation is there between the fingers, it can be aversion to work also, because that will hinder you from working. No, ladies, when they put their hands in the zinc, they don't want to wash the plates, so they will get irritation between the fingers. Yes. Wrist can also be, yes, when they wash the vessels, yes. Wrist can also be what? Day-to-day activities and more of support and responsibility. Wrist also for support and responsibility. Let us talk about the toes, the feet, the toes. Here in the toes, first let us talk about the left-sided one. Now you all have to tell me, okay? Left-sided, okay? Big toe. Left-sided big toe means what? Left-sided means what? It is from the home front. It is with our children. If it, yes, if it is an unmarried person, left big toe can be mother. If it is father, it will be the right big toe. Sai Narendra. If it is the right big toe, it can be our father for an unmarried person. If it is for a married person, then it will be your spouse. Right will be the partner or the wife or father also. In case of unmarried persons, that will be the most important person in your life. So left big toe for a married person who are having children, it can be son. Yes, Shubhangi, it can be your first son. It can be your first son. And the second toe can be your other children, second child or other children. Yes. And if it is on the right side, it will be one of your close friends. One of your close friends. Yes. Now third toe. Okay, third toe on both the sides, it is the same thing. For the third toe, it is something related with the money. Something related with the money at the home front, it can be the left side. And something related with the money or some irritation at the workplace can be on the right side. Right third toe or left third toe. Then the fourth toe, if it is the left side, it is any conflict from the home. Any conflict. Yes, Shubhangi. And if it is on the right side, any conflict at the workplace, be it any conflict. If it is lot of anger at the workplace and lot of insult at the workplace, what can you expect? But now we are talking about the syphilis. Initially, the inflammation is gone, the construction is gone, and now some obliteration can happen of the blood vessels. The cutoff of the blood vessels can happen in the right fourth toe. Ulcers also can happen. Yeah. If it is a sloughing kind of thing, then ulcers also can happen there around the nail, etc. It will start as an irritation, and then later on it will go into deep ulcers, etc. No, or serpiginous ulcers, or ulcer can spread and the ulcer can turn into gangrene. All these things happen in the right fourth toe. You can put up the question directly if The person is a right-handed person, okay? If he is a left-handed person, everything will be ulta. Everything will be just the opposite. So that also you have to first see the handedness. Now, how will you see for the handedness? You cannot ask for the patient. Now, ask for the patient. Patient will be always confused. Huh? Ask him to clap the hands. Yeah, all of you know, I think. So when you're clapping, your right hand will be coming on top means you are a right-handed person. If it is a left-handed person, he will be clapping like this. Okay, or you can ask them to open the bottle, the lid of the bottle. Yeah, if they are using the right hand to open now, sometimes what they will do is they will keep this and they will turn with the left hand like this. They will turn, they will keep the right hand static. So it will, with the keen observation, with one thing, you should be with one glimpse, you should see that he is a right-handed or a left-handed person. Once there is a joke, Vijaykar sir asked, okay, some points he got and he wanted to confirm whether he is a right-sided person or a left-sided person. So he asked the child to clap the hands, and the child did not clap like this. The child did not clap like this. The child clapped like this. That is Baraita. That is Baraita. And he confirmed it. Super. That is Vijaykar sir. And now the fifth one, okay, the fifth toe, that is the smallest toe. The smallest toe is for name and fame, both the sides. So name and fame from the family, from our close circle will be on the left side, and name and fame at your office front will be on the right side. So that is regarding the fingers and toes.
ഇല്ല.
Any
ഫീറ്റിലൊക്കെ കോൺസ് ഒക്കെ വരില്ലേ? അപ്പൊ ഫീറ്റ് എന്താണ് കൺസിഡർ?
Feet means you're standing on your feet. You're standing on your soles. Yes. So it is a day-to-day activity. Stand something, a corn is giving you pain when you're standing, which means what? A calcanean spur is giving you pain when you're standing. There is pain in your soles. There is numbness and tingling in your soles. You are not able to get the grip of the ground. You are not rooted. You are not grounded. Yeah? You're questioned, or your stay in your family or your relationship with your children when you are getting old. When will you get diabetic neuropathy? At what age will you get peripheral neuropathy, whether you are diabetic or non-diabetic? You will get that after the age of 50 or 60, when the relationship with the children is not so grounded, when you feel that your place is in the home is not needed. Children are standing on their own legs. They don't need us at all. Then automatically you will start withdrawing, and your tendons also will become bent, and your toes will become distorted. You would have seen. Second toe, just a minute. Kylveri is asking something.
Second choice.
Second toe on the left side means it is the second child or other children. Yeah. If it is on the right side, it can be your close friend. It can be one of your close friends. So where were we? About the peripheral neuropathy. When you are not rooted, when you are grounded, when you are doubtful about your own existence, like why should I be here? Children are able to take care of themselves. They are not discussing anything with me, and they are only taking the decisions. So I am no longer needed. I am not respected. All those things will be there, and there will be capillaries cut off. Blood circulation towards through the narrow blood vessels will be cut off, or it will be reduced, or there will be vasoconstriction. There will not be enough nutrition or blood supply towards the soles. If the ankle swelling or feet swelling, only sadness or any other. So Narendra is asking some question about the ankle swelling. Ankle means what? Again, it is the day-to-day activity. Daily you have to stand on your feet and ankle. If there is swelling, what does that mean? It can be either isolation feeling also, or it can be hurt feeling. If there is lot of swelling, you can always think that, are you feeling alone? Yeah, in your life, or according to the right and left, you can frame questions like that. Are you feeling alone at your home? Are you feeling alone at your office? Do you feel friendless? Are you sad? Are you hurt? All these questions can be framed for such things. For the heel, again, heel is for moving forwards. When you are wearing high-heeled chappals, you will be having that like with the thrust, no, like you will be able to move forward. When you are having a doubt about moving forward, how to move forward, yeah, or when you're overexerting yourself for a purpose, you want to excel in something, you want to excel in a performance, and you're overdoing that. Why? You are expecting some results. I want to go forward in my life. So then when you're getting pain, when see you will be sitting for long in one place, you are not having any pain. But when you're trying to walk or when you're trying to step on the foot, it hurts deeply. That is calcanean spur or plantar fasciitis, where you get the initial pain, and when you start moving, there is no pain. So that clarity is not there. What will I do in my future? How will I go forward? That doubt is there, self-doubt is there, or some insult is there, or some support is not there. All these things can cause to plantar fasciitis or the calcanean spur. And coming back to corn, it is creating a lot of pain. It is sensitive. It is giving you a hurt when you're standing on your foot, which means what? You are not able to stand, which means something is giving you a hurt. Why are you not able to stand on your leg? Either if it is the left leg or the right leg, what is hurting you? What is preventing your performance? Are you bored, or are you not getting appreciation for what you're doing, for the work you're doing, or are you not getting the promotion at your office, or are you simply getting criticisms or ridiculing at your place? What is hurting you? Why are you not able to stand on your foot? And this is a day-to-day activity also. Yes. Souls, again, day-to-day activities. You are standing on your souls. You are grounded and rooted on your souls, Sai Narendra. So where you feel that you are not grounded, you are not rooted, your grip is slowly wading off. And you are not anymore needed in this situation. That kind of a feeling, then you can ask for such things. Do you feel unwanted? Do you feel unloved? Or do you feel disrespected from the family or from the society or whatever? According to the right and left, you can frame the questions. Or from the in-law side. Anything from the in-law side can also fall on our right side.
Okay.
Fingers, toes, hands, feet, fully over.
Yes.
Okay. Are we done with that?
Ready to go.
Yes, yeah. Ready to go to the next thing. So here we were talking about the necrosis, about the, yes, the infarctions and the frostbite or the blood circulation cutoff, the thromboangiitis obliterans, that is with the digits. And now we are coming to the liquefactive necrosis, which that also we talked about, no? The sloughing and then the pus discharge in the cases of infections or abscesses. And coming to the fat necrosis, that affects the breast. Now we shall talk about the quadrants of breast. So if it is an unmarried girl, what are the quadrants of breast? 4 quadrants, right? Yeah. Upper, outer, upper, outer and inner, lower, outer and inner. Inner means towards the heart, close to your heart. So for a girl, an unmarried girl, right side means right side means it is the father's side, no? So who will be most important for her? Close to her heart. For an unmarried girl, it will be her father. And if it is, so that is the upper inner quadrant. Now upper outer quadrant will be her near cousin, yeah, or maybe her boyfriend, no? Near cousin or boyfriend, etc. Lower inner quadrant, that can be from her workplace, that is close to her heart. It can be her project. It can be her pet project, her baby project. Or it can be something very close to her heart like work or money or position. That can be on the right lower inner quadrant. Right lower outer quadrant will be somebody, her friend, some of her friends. Yes, all the 4 quadrants of the right side. Got it? Now on the left side, who is closest to her? mother, very close to the heart, mother. So mother is in the most important place, that is the inner quadrant, upper inner quadrant. Upper outer quadrant can be her sisters or her brothers, blood related to her. And lower inner quadrant will be her home, something from her home, her childhood place, etc. No? And the lower outer quadrant can be, it can be a pet, or it can be a sisterly, like anybody, can be an adopted sister, can be her auntie's sister, some cousins, or anybody who considers as her sister. Are we good to go? Any doubts? Now, if it is a married woman and she is having children, it is totally different now. So this is how you have to frame questions if the girl is coming with a fibroadenoma. Sometimes the fibroadenoma will be not a single one. It will be in both the sides and it will be multiple. That is very common nowadays, no? Then how will you frame the question? First, where did you get it? Where was the first adenoma felt? Was it in the left side or right side? And in which quadrant it was? That helps us a lot. And in the case of married women who are having children, we come first to the right side. Who is closest to her heart? Yes. Inner quadrant, upper inner quadrant on the right side will be for her husband. And the outer quadrant, upper outer quadrant will be for her in-laws. Upper outer quadrant will be for her mother-in-law or for her father-in-law, anything. And the lower thing, yes, that will be for her father. Lower inner quadrant will be for her father. And lower outer quadrant will be for the work and money, for business. Yes. And if it is the left side, now you have to tell me. What is closest to a mother? Left side. Inner quadrant. Towards her heart, closest to her heart. It will be the eldest child. It can be any child. It need not be eldest child always. But then the first child maybe, yeah. And then if it is the left side, lower inner quadrant will be for other children. Upper quadrant will be for the first child and the lower quadrant will be for the lower inner quadrant will be for other children. Upper outer quadrant will be for mother. Upper quadrant, that is for mother. Outer quadrant on the left side. And the lower quadrant, lower outer quadrant will be for siblings, other siblings, her brother, sister. Even after marriage, no, we have all those relationships with our, if any quarrels happened or if any misunderstanding happened with the siblings and all, no, after marriage happens, all those things happen, no, because new persons do come into our house. Brother also will be married or sister also will be married to somebody else, and due to such influences, lot of misunderstandings can happen, or anything from the home, that also will be, the conflict will be expressed at the left lower outer quadrant. Now, what is the conflict, general conflict, if it is a cancer in the breast? It can be a
Lack of love.
breast is a nest worry conflict. Nest worry. Nest worry means generally for the home, something from the home, something for her children, yeah, something for her home, for her home. Husband also belongs to her home, no? And mother-in-law, father-in-law, everything belongs to her family only, no? And then the children also belong to her family. And this daughter-in-law or this wife will have to run around to meet everything. She will have to manage father-in-law, mother-in-law. She will have to manage husband and husband's business also sometimes. She will be automatically the first person for the husband, no? As a business partner also she will be. And she will have to take care of the children's education, everything, teach them and all the school things and the home thing also. All the relatives who are coming to the home and the entire home stuff, including the servant maid, she will have to manage. This is the nest worry conflict. Out of this, you can pinpointedly demarcate according to the quadrant. You can ask, where did the first eruption happen, or where did the first inflammation happen, or where did the first fibroadenoma happen? And accordingly, you can dig into the story. Every story will be different. But then where did it start? That matters for us. Okay. Now, generally, when you ask for, in the fibroadenoma cases, when you ask for nest worry conflict, you will not get anything. If it is children, girls, you will not get anything. They will say, I don't have anything. There it can be, you can always ask about argumentative conflict. Did you have any argument with your father? I have cured a case of breast adenoma. It was huge, just like the size of an orange. I treated it with platina. This girl had it was in the right side, inner quadrant. Father. She had a very bad argument with her father, and her father passed away also. She wanted to go abroad for studying, and father did not allow. She was the only daughter. She made a point that I have to go. And she was such an arrogant girl. That's why I gave her platina. And she immediately the swelling became so soft. Within 2 weeks' time, the swelling became so soft. It was so hard initially, which means this girl was very hard-hearted. And she was so stubborn on her face. She was like, I want this, miss, I want this. She was so adamant. And later she did not even go to the foreign place. But unfortunately, her father passed away, and now she married off and she is settled well. Kind of casting off only. Yeah. Okay. Now, all the parts of the breast are done, no? Finished, no? Everything. Right side, left side, all the 4 quadrants, everything over. All the doubts over. Nothing is pending. Everything is over. Then I am going to ask you a question. Then what is it for areola and nipple of the breast?
Capturing.
Yes. Yes. Areola is for, yes, Shubhangi is saying nourishment. Yes, that is the general feeling. Areola is for children. Yes, entire breast is for children, home and all. We talked about that. Nourishing children, of course, yes. Areola is for lubrication, oiliness, and for protection. Areola is for protection. That also happens, no? Sometimes Paget's disease happens upon the nipple. The nipple will get degenerated. And areola, there can be abscess around the areola. There will be a lot of that Montgomery's tubercles, no, studded upon the areola. They are all sebaceous kind of thing, no? They will be secreting oily sebum kind of thing, solution kind of thing, oiliness. That is for lubrication and it is for protection. So which means upon the right side and left side, you can always frame questions accordingly. So any relationship issues, yes, cracks of nipples, you are hurt. You cannot feed the baby. If there is cracks of nipples, if you are feeding, if you are a mother, how can you feed the baby? Sometimes even blood also come. I have seen cases like that. Nitric acid is one of the medicines where you are not able to forgive, where that anger and hatred and resentment stays in your mind and you are not able to forgive that and not able to forget that, you can think about nitric acid. Graphitis is a good medicine. Even belladonna is a good medicine for that, cracks of nipples. According to the stage and according to the hurt, you can frame questions. You are not able to feed the child. I have seen ladies crying and feeding. And the mothers and mother-in-laws will be in utter surprise. What is this girl doing? She's feeding the baby and she's crying and feeding. Oh my God. All those things are stories. So so we were dealing with the fat necrosis. Fat necrosis generally happens in the fatty areas like breast. So traumatic fat necrosis can be due to after any injury to the breast. If it is spontaneous, it can be an autoimmune thing. Like if it is of a very low immune response, very low immunity for the patient. If the diabetes is very high sugar levels, then it can automatically cause fat necrosis. Or if there is a lupus or a vasculitis and all, no, like any autoimmune diseases, it can cause spontaneous fat necrosis. And if it happens, if the cancer happens in certain breast lobules, it is known as lobular fat necrosis. Shiny is asking, nowadays many women does not lactate. Is it indifference to children? Yes, very well said. So what are all the functions for lactation? What are all the behind the story? What are all the things which are needed? We need prolactin hormone, right? And then what else? We need that oxytocin. Only then the stimulation will happen, the spasm or the movement will happen, that erection of the nipple will happen and the milk will be ejected out. With the sucking of the child, with that first suckling reflex itself, the oxytocin will be released and it will be automatically helping the ejection of the milk, which is not happening. What does that mean? Even if prolactin is there, sometimes no milk will be simply flowing out of the nipple, but then the child is not able to suck.
The dryness of emotion. There is no love.
Lack of emotion, lack of bonding. The child does not know how to latch. Aversion to child or aversion to husband, that will be shown like this. Anger towards, it will be shown in this form. No bonding with the child. Oxytocin is love. Yes. So these are all the connected questions you have to frame. Accordingly, you can ask the questions. If you ask it just like that directly, the patient will say, no, doctor, I want to feed my child, but then I'm not able to. Then you ask, why is this hormone not working in you? All hormones are for love. All the hormones are for love. Without love, there will be no ovulation. Without love, there will be no progeny formed. And after the delivery, the proper labor should happen. For that also, oxytocin is needed. Placenta should be extracted. Oxytocin is needed. Milk is ejected out. Oxytocin is needed. All the hormones are for love. The sex hormones, they are otherwise known as. And these hormones are all synthesized from cholesterol. We talked about this in the last class. Framing questions is very difficult. I say.
Initially, they don't, they take it directly and they won't answer me. ऐसा कुछ नहीं हुआ. We don't have any such kind of things. So your case, entire case is complete. From
Yes.
there, how to find out, that is a major problem.
Yes. So, according to the pulse of the patient, you have to move. You have to move accordingly, slowly and gently. If you want to speed up your case taking, you have to go slow. That is the only answer for that. According to the pulse of the patient. So first of all, you have to take the person in your hand. You have to take the person, you have to make the person feel comfortable with your aura. You have to, without hurt, you have to frame the questions. Without hurt means you cannot put a direct question. Like Vijaykar sir puts a question, you cannot put the question just like that on the face. The patient will not be ready for that. Maybe after several visits, the patient may be ready, but maybe in the first time, the patient may not be ready. For that, what you have to do is, maybe you can draw a picture. You can take some time with the patient. You can ask about all the other things. You can ask about all the scenario, what had happened during the time of the pregnancy, during the time of the delivery, how the lady went through the trauma of labor all alone in the labor ward. Husband is simply standing outside and smoking or having tea. Mother-in-law is chit-chatting. I am only alone here. And I know nobody here. And I am going through all this pain, which is so unbearable for me. There is nothing like unbearable and all in labor pain. If you have the proper conviction, if you have the proper trust, everything is bearable. Yes, everything is bearable and everything will be happy and you know, okay, what it is and all that. If you're having doubt, if you're having hurt, if you're having anger, if you're having that neglected feeling, the labor will be very difficult and the labor will be very prolonged. And without that proper support, the child will be having what? It can go into ADHD. Until then, the fetal anomaly scan of the 5th month, everything was normal. There is no phalanx tetralogy, nothing. All the heart, ASDB, nothing is there. Brain is there. Brain is proper. Heartbeat is proper. The nasal bridge is very proper and there is no Down syndrome, no chromosomal trisomy, nothing. And why did the child get ADHD is a very common question. And when you go back into the labor history, what did the mother undergo at the labor ward? That has made all the change in the behavior of the child, whereas the structure is very normal. Everything is very normal. The structure is very normal. Only the functioning, only the intellectual part is affected. Why? Only the emotional part is affected, not even the intellectual part. The child can learn something. Parrot speaking will be there. Occupational therapy, speech therapy will help the child because the intellectual part is still able to absorb things. The patients will say, no, the understanding is better, learning is better, but emotion is gone. The social behavior is not there. The understanding is not, emotional understanding is not there. They will beat the mother, they will pull the hair of the mother. Even if the mother is crying and pleading, child doesn't understand. Why? That emotional feeling is not there. Why? Because it is gone between the husband and wife. That emotion should be there. That understanding should be there. Even if the husband is standing outside in Indian scenario, husband will be standing outside. But then the child, lady, or sometimes he will be at the war front or he will be in US. But still, the moral support and the element of love and emotion should be there. Then the progeny will be very healthy. Yes, that is the answer for that. So for framing questions, you have to always look into the constitution. Anyway, the constitution of the mother or constitution of whoever patient is sitting in front of you. Accordingly, you have to sometimes praise the patient. Wow, you have done a good job. I know all these things are not easy. Being in the labor ward alone and all, how, madam, how did you spend those 6 hours? No, I know it is very difficult. And where was your husband at that time? Was he there? With all this kind of drama, you can find out the lady will start pouring out. No, doctor, my husband was away. He was blah, blah, blah. And my mother-in-law, again, blah, blah, blah. You are getting answers. If you ask, what was the thought process you had when you were in during the labor? Mother will say, I know nothing was there. I am all okay. Yes, I did not have, no, I did not have any problem. This will be the answer of that person.
Yes,
If you ask like
maximum
this,
times.
you cannot frame questions. You have to be the patient. You have to be so empathetic to the patient. Yeah, you have to you have to create a small drama there in order to handle the patient. It is according to the type of the patient, whether it is glass or whether it is metal or whether it is wood or concrete. No, accordingly only you will have to frame the question. You will get the pulse of that, no, when the patient comes to you. Yes, you have to make them comfortable. You have to make them, that trust should be there. Then you have to think in the angle of the patient and put forth 2 or 3 questions. Then the patient will bite the bait. Then they will be pouring up. Convert that into whatever rubric you want according to the psoriasis, psychosis, syphilis. If it is psoriatic, if it is an acute thing, take ailments from. If it is construction, okay, some rubrics should be there. Some society rubrics or some intellectual rubrics should be there. And if it is going to the syphilis, then definitely delusion or delirium rubrics should be there. The same condition can be every condition has got a 1st degree, 2nd degree, and 3rd degree rubrics in our repertory. That is one of the biggest boon which we all have. You can put the search and find out what are all the rubrics coming there. And out of the several rubrics, you find out which is most syphilitic to the case and take that rubric. That's all. The analysis and the case taken. This is why we say that a well-taken case is half cured, because this doctor is understanding what all I felt, what I am feeling. This doctor is able to understand. And the doctor asked me the same questions which I went through literally in the labor room when I was alone. Even my husband did not understand, but then Dr. Sai Narendra understood. Huh? So this is how the patient will be feeling. It is art and science, yes. Homeopathy is art and science, yes. So this is how the bonding comes, no, like with the doctor. That is very important. Yes. Now we go to the next thing. Next, that is page number 102. Now I shall little bit hurry. I want to finish this lesson today. Disfigurement. Yes, that is syphilis. Gangrene. Distortion of parts of the body. Ulcerations. Lacerations. Bleeding. Uncontrolled bleeding. Okay. Sensitivity out of all proportions. Deep bleeding cracks. Bleeding distorted ulcers. Distorted healing wounds. All these are syphilitic. So we talked about the necrosis in ample. Now we are going to apolysis or apoptosis. This is a process by which the different parts of the body undergo programmed destruction of self. That is nothing but the autoimmune kind of thing. The death of a cell is due to activation of internally controlled suicide program. The best rubric is death desires. I don't want to live. An internally controlled suicidal program happens over a period of time. Doomed cells are removed with minimum disruption to the surrounding tissue. Only that area will be undergoing cell death. It is a programmed cell death. No external influence is happening, no trauma, nothing, but mental trauma will be there. Disease encountered in this type are all autoimmune diseases like rheumatoid arthritis or motor neuron disease, etc. Here, the gun of destruction is pointed towards self. So what is the action by Vijaykar sir? Like this he will do. The gun is pointed towards yourself. This is autoimmune. Destruction of your own antigen is considered as an enemy and an antibody is created for your own antigen. This is autoimmune. Homeopathic considerations. Next paragraph, okay. It is obvious that constitutions that have a tendency to destroy self will suffer in the long run from autoimmune diseases. And those that are violent, not on self, but on the outside, will suffer from other destructive diseases. There is no escape from syphilis. Why? Syphilis means death. Dust to dust, every man must. Without syphilis, the next generation cannot come. Yeah. After Sora, there is a period of psychosis where the progeny happens, the reproduction happens, and you attain name and fame, and you attain job, etc. You earn money, you earn car, bungalow, etc. After that, you go into retirement, every person without fail. And you go infirm, diseased, and all that, and then comes the syphilis, either in the form of autoimmune or in the form of destructive. If you are a self person means what? I cannot blame on others. If at the drop of a hat, they will think that, okay, I should have kept the thing around the table very neatly so that the child would have kept the hat correctly on the table, etc. Their thought process will be going on like that. It's not, if it is the destructive person, the opposite person, what will he do? Everything was correct here. The child only did not keep the hat properly there. So if it is blaming on others, it will be destructive disease that you get. If it is self-blaming, it will be autoimmune disease that you get. So remedies that are self-destructive are the ones that think about suicide seriously, like Oramet, okay? A planned death, right? For Oramet, how they will do? They will not go jump out of the cliff one day. They will have an enormous planning that their family should not suffer. I'll keep this much amount for my daughter. I'll keep this much amount for my daughter-in-law. I'll keep this much for my mother, for brother, for this much. Everything will be done and dealt with. After that, they will jump one day quietly. That is Aurum. Yeah. Others like fluoric acid, who never self-destroy, but lead to external destruction, will be useful in cases of other destructive pathologies like ozena. What is ozena? That is caries of the nasal cartilage, right? So here, what is affected here? Nose means your esteem, yes, and cartilage again esteem. Your ego is affected. Yeah. Ulcers, mouth ulcers, stomach, ulcers in the stomach, gastric ulcers, duodenal ulcers, colon, rectum. Now come on, tell me. Mouth, stomach, duodenum, colon, rectum. All belongs to which system? Gastrointestinal system. And that belongs to what? That belongs to your family. Gastrointestinal system means the family. And what is the head of the family? That is the liver. Head of the family is the liver. And where is your place there in your family? Is it mouth? Is it esophagus? Is it stomach? Is it duodenum, jejunum? Is it ileum, colon, rectum?
Stomach.
Stomach means you yourself. I, me, myself, you. That is stomach. And esophagus means what? Something above the stomach. Above the stomach means what? Yes, Shubhangi? Head of the family. Yeah, it can be your guru. It can be your father. It can be your mother. It can be your boss, whom you respect. Okay, whom you respect. Esophagus. Somebody superior to you, whom you love, whom you respect. That is esophagus. And what is the duodenum, jejunum and all will be for the brothers and sisters. Yes. Any connection means what? Junction. What are all the junctions there? There can be a connection between the esophagus and the stomach. Esophageogastrial. No, what is that? No, that is the cardiac orifice, right? So what is that connection then? If it is loose, if it is psychosis less, elastin less, if it is loose, what is the disease? GERD, GERD. In GERD, what happens? The acid reflux happens. There is looseness at the gastroesophageal junction. Junctions means the relationship is affected. Relationship of yourself with your superior, with your father or mother or boss or guru is affected. So what is that? What is that hurt there? So that is the psychosis. If it is syphilis, it will be regurgitation, that is giving back. Come on, take it. I don't want yours. I don't want this. Take it away. That is giving back. Regurgitation. Who is suffering? You are only suffering. Not resignation, Shubhangi. Regurgitation. Regurgitation. Sai Narendra, yes, I shall repeat. Stomach means it is you, okay? Y-O-U. You. You as a person. Yes? Esophagus means somebody superior to you. Esophagus is above the stomach. So it can be your mother, it can be your father, it can be your teacher, it can be your guru, it can be your boss, somebody whom you respect. And the junction means it is the relationship. And if your relationship with any of these persons is not good, there can be GERD. That means the gastroesophageal reflux, which means the relationship is not good and you are not able to digest certain things properly. And the burps are coming up with enormous force. The burps are coming up and you are suffering from heartburn. You are having the burning all this place. Yes. That is GERD complaint. And if it is syphilis, then there will be regurgitation. In regurgitation, what happens? A piece of the food particle comes out, which means it is taking it out and giving it away. Take it away. I don't want it. I don't need your blah, blah, blah. I don't need it. I'm rejecting it. Outweigh rejection, that is regurgitation, that is syphilitic. Because I'm so hurt that I'm not able to digest this at all. I'm not able to keep it also. I don't want it. That is the attitude. Even disgust, that can cause vomiting. Disgust is one level more. Disgust means it is vomiting. Vomiting also can happen in disgust. Or nausea. Constant nausea. I can't even take in also, no? Yeah. That is with disgust. Now we wanted to talk about the duodenum, jejunum, ileum and all will be regarding the brothers and sisters of the family. And if there is any duodeno-jejunal junction problem, what is that? The quarrel or dispute between the brothers and sisters or among the brothers and siblings. Yeah. And coming to the ileocecal junction, what is that? Ileocecal junction means what? The small intestine going into the large intestine. That is the ileocecal junction. That is the husband and wife relationship. Ileocecal junction, regional ileitis, Crohn's disease. All these things are little bit deeper. I have treated cases like that, Crohn's disease and all. And the entire intestine was ulcerated and even the tongue was ulcerated, even the lip was ulcerated. The lady was not able to eat anything. And I don't know which remedy I had given. I think I had given her natrum phos. Why natrum phos? Why natrum? And I talked about this natrum in the other class also, in the colon polyps in the colon. The best medicine for family, the best medicine for family is natrum or magnesium. Ulcerative colitis, what needs to be probed and what should be followed? Yeah, criteria. Yes, ulcerative colitis, how long will you wait? After you given improving a lot, there is no bloody discharge, there is no mucus discharge. The number of motions, the number of motions are reduced and the patient is passing only 1 or 2 times motion per day. There is no stomach pain. This is the order, okay? I'm is able to eat food properly. There is no nausea and the patient is putting on weight. Yeah, according to this order only, the improvement will be seen, Sai Narendra. And all is well. How long will you wait? How long will you keep the patient on SL? How long? 3 years. The curative period for ulcerative colitis is you have to wait for 3 years. And for this 3 years, the patient should be asymptomatic. Then you can term it as cured. After that only you can publish the case. I have cured a case of ulcerative colitis. Like that, you can, if you want to publish, you have to wait for 3 years. 3 years of asymptomatic period is mandatory for ulcerative colitis because it can get relapsed again and again and again. It can get relapsed. And ileocecal junction, we talked about ulcerative colitis. We talked. Coming to the rectum, last time also we talked, I think. That is about the shit feeling, either from the family or from the anywhere, from the neighborhood or from the office, or the shit feeling if you're getting, that is the anything connected with the rectum. Natrum for relaxation. Why natrum force? Yeah, natrum force according to the constitution of the patient. This patient is a dancer and she is very lean, thin, emaciated, very phosphorus constitution, and she will kind of come and hug us through her body language. Although not real physical hug, but then the patient is so welcome person, welcome kind of a person with all smiles and all that. No wonder why I had given her natrum force, and she was having lot of bleeding also in the stools. Conflict for ulcerative colitis, yes. Any anger, any resentment, lot of anger towards the family. Collection, what is large intestine for? That is for collection of the fecal matter and collection of the water. And all the water will be absorbed and only the fecal matter will be remaining inside the colon. So what is that? That is the after digestion, the waste products are collected there in the colon. So how what kind of an argument will that be, or it will be an ugly argument with the family, or where you are treated very low in the family by the parents or by the teachers or whatever, where you are not able to tolerate that at all. That will be the conflict for ulcerative colitis. So now what? Now we are about to close this. Is there any doubt regarding the digestive? So now chronic or acute renal failures, infarction in the heart, atelectasis of lungs. Lungs means what? Again, any question of fear there, any question of fear. Interstitial fibrosis, again, something regarding the lungs. Emphysema, again. So all these things are different gradations of fear. Accordingly, you have to frame the question. You have to come down according to the level of the patient. You have to praise the patient. You have to be the patient, be so empathetic, and then you can take the conflict. Then cancers, cancerous ulcers, autoimmune diseases like rheumatoid arthritis, autoimmune thyroiditis, Hashimoto's disease, gangrene, motor neuron diseases, Parkinson's disease, cerebral paralysis. What are all these things? All these are syphilitic and all these are destructive. And many of them are autoimmune. Yes. So in the syphilis, only two things are possible. One is the necrosis and the other one is apoptosis or apolysis. So this apoptosis can be autoimmune, isn't it? Or destructive. Apoptosis will be autoimmune and apolysis will be destructive. So these are the things which we learned today. And coming to the mental, vital and motive phases. What will be the physical structure? The physical structure of the psoric will be of the mental type, where there will be the pear-shaped or the tapering chin kind of thing. That will be the psoric phase. And in the psychotic, it will be the vital phase, where it will be very, very roundish, no? Like Lalu Prasad Yadav. That is the basic example what we give there. And how will it be in syphilis? That is the motive phase, mental, vital and motive. In syphilitic, it has something that which repels you, something that which repels you, something that is just not normal. It may be ugly, it can be distorted, it can be repulsive. The nose and eyes can be extra sharp like a dagger. No, somewhere you will feel irksome, you will feel irritated, or you will feel kind of put down, or you will feel kind of that disgust or ugly or whatever. No, that kind of a. The best example is from our epic story Mahabharata. The best example is Shakuni. How it was portrayed also, no, like that. One eye is like that, the crooked face, and the nose will be like this, and the teeth will be black. The Carey's teeth will be all. The laughter, their laughter also will be like some kind of a laughter. It is an ugly laughter, and their legs, no, like they will be having already polio, or their walks will be like this and all that. No, yeah. So that is syphilis. Can we call it a day?
Yes.
Can we all meet again in the next class? Bye, dears. Any question, any doubts, put in the group. Dr. Arya and Adira will put forth it to me and let us try to solve it off. Thank you,
Ma'am,
guys.
there is a question by Sai Narendra.
What to probe in SLE case and what should be the what all remedies can we think of? SLE is systemic lupus erythematosus. What does that mean? So it is an autoimmune disease and all the joints will be affected there multi-system. According to the symptoms produced by the patient, you have to write down every symptom produced because it is a syndrome. There can be blackness, there can be, so where is the blackness and what is the embarrassment that you felt, etc. You can ask. And if there can be vasculitis also, there can be red spots on your leg. Which leg did it come first? No, it is like several individual diseases in one person altogether. That is a syndrome. And you will have to take note of every symptom. Accordingly, you can frame the question and come to the whole of the person, holistic, come to the whole of the person, okay, WHOLE. And the joints, which was the joint first affected, what are the defects happened in the joints, etc., etc. These are the things which you have to probe. You have to probe for esteem, you have to probe for self-devaluation conflict there. And what are the reactions of the person to such kind of a conflict? Did the person express it or suppress it? Mostly it will be suppression. That only goes to the autoimmune thing. And how much did it go? Did it go till the existence conflict? Did it go till the death desires or suicidal? Yes. DPO, DCO and all that, no? Death presentiment of, death conviction of, or all those things, no? I have to settle the affairs before I die because I have only very less amount of time. I know my death is near. All these things are death presentiment of. And death conviction of, definitely I'm going to die. Whatever medicine you give or not, I know I'm going to die. So that will be the attitude there. Death desires, I cannot handle this situation any longer. I just want to die. Let me go die. Let me go die peacefully. Death desires. All these things are the autoimmune rubrics which you can think of. The remedy can be anything, mostly metals. They are degenerative, no? Like aurum, plumbum and all that.
Ma'am, if it has started from the gums,
It has
which
started from the gums.
started, yes, ma'am. Then how to?
Okay, if it is very, very long back, then what are all the symptoms now? You have to take note of all the symptoms. If it is from the gums, what is that? Something, no, like he was not he was not able to chew, he was not able to grasp, or see, he was not able to take something, gums. And lined with blood, no, something regarding the anger or love issue also there in the gums. Okay. No need to ask from the gums, okay, so this could be, this could be, this could be. The nail, you cannot ignore the gum. But then the totality should not be compromised there. The person as a whole should be there.
First affected. So
Yes.
if it has affected another organ, there has to be the susceptibility for that organ also to catch that
Excellent.
imprint.
Well said. Well said. And there was suppression every time. If it was at the gum, then it could have been there at the gum only. No, why did it go to other joint? Yeah. So that condition was causing suppressions again and again, or some allopathic medicine or some homeopathic medicine also would have suppressed. That is the journey of the disease. So the journey of the disease should be proper. The layer should be written against every sentence, and the miasm should be written against every sentence to tackle a autoimmune disease. All these methods are, then you will not miss any point. And ultimately, you will be able to come to a beautiful medicine also, which covers the entire totality and the whole of the person with the disposition and with the thermal centers. You will be able to rule in or rule out the remedies. And it will be a state remedy. Don't worry about whether it is a GCS or a state remedy and all that. Whatever you get now will be the state remedy. Give that medicine. Okay.
Thank you, ma'am.
Bye, dears. We are past our time. Let's say goodbye now.
Thank you, ma'am.
Thank you. We shall again meet next class. Okay, bye. Love you all.